So let me begin. First of all, I want to welcome everyone here this evening for the first part of my series, which is called Conversations. And we have so many very special, wonderful, interesting people in our community that we often don't have a chance to interact with. We're in different places. People have other competing commitments. But as I said before, this is an opportunity, I thought, to have an opportunity to dialogue, to have a conversation with some, again, people who I think are very interesting. Just to review, I'll introduce Rabbi Haber, our guest for tonight. Next week is Sister Lucy Thorson and somebody who will also be joining her. Sister Lucy is the current chair of the Christian-Jewish Dialogue, and also someone who's very connected with the Sisters of Zion, a very old group that is committed to and was founded in the 1800s for dialogue between Christians and Jews. And then the third one, I'm going to be dialoguing with my son Gabriel, my older son, who is going to be talking about his position as a chaplain and as a chaplain for the New York City Department of Corrections. So without further ado, let me unmute Rabbi Haber. Rabbi and Dr. Geoffrey Haber is the Director of Spiritual Care at Baycrest Center here, right down the street from where I live. And he provides spiritual and religious care, counseling, and guidance to the patients, residents, families, and staff of the Baycrest community. Prior to being at Baycrest, Rabbi Haber served as a chaplain at Hospice of the North Shore and Greater Boston, concurrently with Seasons Hospice. He also has been a pulpit rabbi in various communities in the United States. He is also, if you happen to catch his picture before, he is also let's see if I can get this correct. He is a lieutenant commander in the U.S. Navy Reserves Chaplain Corps. Rabbi Haber graduated from the joint program between the Jewish Theological Seminary and Columbia University. Rabbi Haber is very special because he's one of the, and there's a few of them, one of the rabbis in our community who are originally from Canada. Rabbi Haber was born in Montreal. And many of us, as you know, were born in the States, but Rabbi Haber, Rabbi Scheim, Rabbi Cutler, I think are Canadian, are original Canadian residents here. And one other thing that is important to know, one of the reasons that I chose to ask Rabbi Haber is that we have a friendship that goes back probably, I hate to say, but probably over 40 years, if not a little bit more. I think that I started joint program in 1975. And
1977.
You started in 77?
Yeah.
Yeah. So that's where we first met. And this is one of the things that, you know, when you're a rabbi, and especially a person like Rabbi Haber, who I also have known his wife for that long as well. They also met in New York at the seminary. So this is a relationship that goes back many, many years. And it's nice to For us, sometimes we find ourselves in different places throughout the years, but now it's been a very special opportunity for me to reconnect with Rabbi Haber, and especially in this very special and interesting position in which he now finds himself. When I was talking to Rabbi Haber before, we were saying that he's been here for 8 years already, which I'm sure is hard to believe.
It sure is.
But Rabbi Haber, can you tell us a little bit, now that you've been there for that long, what is it that you found when you came to Baycrest 8 years ago, and now in your position as the director of spiritual care? I think it's a much different model than what many of us are used to in the past, especially for Baycrest and other places. So tell me a little bit about what has changed for you and for Baycrest.
Sure, happy to do that. Firstly, thank you very much for inviting me to come on and speak with all of you. It's a delight for me to be here and to share with you. I have a deep passion for chaplaincy and spiritual care, so I'm happy to share all my wonderful feelings for chaplaincy. Baycrest has a long and noble history of chaplaincy. The first full-time chaplain was a Rabbi Greenbaum, and he was an Orthodox rabbi, and he provided spiritual care for the Orthodox within the Baycrest community. He was succeeded by Rabbi Burlat, who is also an Orthodox rabbi, but Rabbi Burlat was more ecumenical, if you will. He encouraged the Reform community to have volunteer presence here at Baycrest. He was also concerned that in the hospital wing of Baycrest that there were a number of non-Jews, and so he facilitated the ability to have a Thanksgiving dinner and service, a Christmas dinner and service, and an Easter service and dinner for the non-Jews. But his focus, as was Rabbi Greenbaum's, was on what we call pastoral care, which really was providing for the Jewish community and facilitating for others if they so wish, but from a volunteer perspective. When I was brought to Baycrest, it was with the idea of creating a new model. That model would be spiritual care, which is far broader than pastoral care. We have 4 operating principles: care for everyone, because everyone's made in the image of God and is deserving of unconditional respect and regard. Provide for your own faith tradition, so we maintain a lot of the aspects of Jewish life and tradition. The only real difference between what Rabbi Burlat did and what I've been able to do is that Rabbi Burlat funded the Orthodox stream and encouraged volunteerism from the Reform stream. But what I try to do is we fund all streams of Jewish presence at Baycrest to an equitable amount, so that all those who find expression within the Jewish community, from traditional to liberal, from religious to secular, will have the opportunity to have their needs met. The third principle we have is facilitate for religions other than your own. Again, what we've done is expand a little bit on what Rabbi Burlat built. We now have one every other Sunday at Baycrest under normal circumstances. We have an ecumenical church service run on a Protestant model. And on the non-liturgical week, there's a hymn sing. What we have brought on as well is that we now have 4 chaplains at Baycrest, and one of them is a Protestant minister. And she is focused a lot on care in the hospital section, which is 65% not Jewish. And again, meeting our mandate to care for all and facilitate for those with religions other than Judaism, she has quite a big task to fill. And then the last thing we do is we advise the leadership of Baycrest on the faith-based needs of those at Baycrest, on the morals and ethics with regard to policy setting at Baycrest, and also about the general morale, not only of the patients, but also of the staff and the families that are engaged at Baycrest as well. So that's a little bit of what we've done and how we've expanded over the years. Rabbi Burlat was a solo operator when I came on board. I too was a solo operator, but I had a mandate to build and expand the presence of the spiritual care department. And so we now have 3 rabbis, one representing the Orthodox stream, one representing the conservative stream, one representing the Reform stream, and then we have our multi-faith Christian chaplain. We've also developed something called Clinical Pastoral Education, which is an education program that I'll talk more about as we go along.
Okay. So you've really changed the model quite differently in terms of the way that you've expanded it. What has been the reaction to this new model from patients, from residents, and also from families? Have you seen a change over the years?
Some of the reactions have been, no. No, it has been very, very well received, because what we're trying to do is provide more attentive care and also trying to meet the needs of a vast number of individuals. So just to give you a mapping of Baycrest, Baycrest basically has 4 components to it. There's the complex continuing care or acute care hospital called the hospital. We have the Jewish Home for the Aged, oftentimes referred to as the Apotex Jewish Home for the Aged. We have the Terraces at Baycrest, which is a aging in place retirement living facility. And then we have this Sippin Community Center, which are life lease apartments that Baycrest owns, but functions essentially in an independent manner. So we're 1,100 beds altogether. And that number will become very important when we talk about COVID at Baycrest, or the lack thereof. So the reaction has been really, really positive. People have felt that Baycrest was drifting away from its Jewish roots, and by implementing a spiritual care program that creates more visibility and accessibility, there's this feeling that Baycrest is maintaining its adherence to its Jewish roots and founding mothers. Baycrest was really founded more by the women of the Jewish community than the men. And in addition to that, the attention has expanded to not just focusing on the clients, patients, and residents, but also on their families, and supporting families as caregivers to their loved ones at Baycrest, and also to support the staff. And again, that has become really, really important during COVID, but even at other times, staff create strong bonds with members of our patient community here at Baycrest, and the ups and downs of those patients affect the feelings and the moods of the staff. And so we're here to provide them support, particularly when a staff member, when a patient passed away who's been very close to a staff member, that we help them with grief support and the like. And the other thing that people like about this approach is that it takes the role of the family member very, very seriously. And finally, that it gives recognition to others outside of the traditional Orthodox community, that we recognize the validity of all the streams within Jewish tradition, and we're funding them so that they can have a presence at Baycrest, that we recognize that there's a large proportion of people in our hospital who are not Jewish, who do have spiritual needs. And Baycrest takes very seriously the message or the mission to provide holistic care, mind, body, and spirit, and realizes that spiritual care really does affect healthcare outcomes. Spiritual care is about people finding meaning and purpose in life. So it's not just religious needs. It's a whole lot more.
So maybe that would connect with the question of what's the difference between a rabbi and a chaplain. I mean, a chaplain can be a rabbi, but what do you see as the difference in terms of what rabbinic chaplains are providing?
Right. So, firstly, a chaplain is very often somebody who's ordained, but doesn't need to be, but they do need to have specialized training. So oftentimes rabbis who serve congregations feel that they would be good at chaplaincy, but they discover that they don't have the skill set that's involved. Because chaplaincy is a specialty within the rabbinate. Just as you have a general practitioner doctor that you go to, but if you have a heart problem, you go to see a cardiologist, a specialist in the practice. So too in spiritual care, you have your congregational rabbi. But if you're in a context, in an institutional context, such as a hospital or the military or corrections or campus, then you oftentimes want to have a chaplain who's been especially trained. So let me back up and tell you a little bit about the training. So in addition to being ordained and having gone through an appropriate rabbinic or cantorial program, one also needs to have 1,600 hours of postgraduate education in something called clinical pastoral education. Of those 1,600 hours, it's divided up into 4 units. With 400 hours per unit, 200 of which are classroom work, and 200 hours of which are direct client contact in a counseling environment. And we learn basically to provide a spiritual and religious interventions together with psychotherapeutic interventions. And in fact, in Ontario, institutional chaplains need to be registered with the College of Registered Psychotherapists of Ontario. So every one of our chaplains at Baycrest is also a registered psychotherapist. And this brings the ability for us to provide spiritually integrated psychotherapy so that we can appropriately counsel individuals who are experiencing life stress or existentialist angst. And basically what we do is, unlike Bikur Cholim, which is you go to visit a client in the hospital and you talk about the weather and you talk about the current events and you talk about what's happening and you are a presence of comfort and support to the individual. Chaplains can go a step further. We can provide spiritual support for people who are experiencing existentialist angst, like what's happening to me? Am I going to die? Is there a heaven? How do I make amends with those I've hurt? Has my life been meaningful? What kind of legacy am I going to leave behind? How do I get my kids to not fight about the inheritance before I'm gone? You know, these kinds of questions. Then there's also emotional support, a shoulder to cry on, a hand to hold, a sounding board to vent against. And then we also provide religious needs accommodations, kosher food, prayer books to fill in, rosary beads, Bhagavad Gita, prayer rugs. And then we also teach at Baycrest. So we teach our patient population. We teach courses on everything from modern Hebrew literature to Bible to Midrash to Talmud to philosophy, depending on their cognitive abilities. And we also teach the staff. It's mostly about Jewish culturation and knowledge about the Jewish holiday cycle and Jewish life cycle, because the bulk of our staff are not Jewish. In fact, the largest religious denomination at Baycrest, if you include the staff, is Catholic. But they work in a Jewish faith-based institution, many of them consciously choosing to do that because they want to learn about Jewish customs for a host of reasons. And so we also teach. So we provide spiritual care, emotional support, religious accommodation, and education. And so this is a much wider gamut than what a rabbi might do upon coming to visit someone in the hospital. And again, because we're all registered psychotherapists, we provide psychotherapeutic interventions together with the religious interventions.
So I think that what you're telling us is certainly that is someone's dog.
Okay, he's telling me that I've had a rough day.
is that you're providing much, much more than what had been done in the past.
Right.
And I imagine that people who are coming in now to Baycrest as opposed to 30, 40, 50 years ago, that their needs are probably much more different. I imagine that many of the people, the residents who are coming in, are people with professional degrees, which may not have happened in the past. And
we have a number of doctors and lawyers in our patient population, as well as businessmen of all sorts, from executives, high-powered executives in multi-province, if not multinational corporations, to owners of mom and pop shops. We have a number of, so Baycrest has the highest concentration of Holocaust survivors in Canada, although that's a diminishing number. But we also have military folks who, we have a number of aces, flying aces from World War II, a number of Korean War veterans. So, the victors and the vanquished, we have at Baycrest. So it is a very interesting population mix. And if you're fascinated with history, world history, Canadian history of the 20th century, these individuals are living testimonies to the history of our nation, the history of the Jewish people, and their lives are fascinating. And sometimes they don't have anybody to share this with. Their kids don't want to hear it, or they've heard it 1,000 times before. But there are so many wonderful lessons that we can learn, and they're happy to share them with us. Also, sometimes they're struggling to work through issues that they've never had the appropriate time to deal with. Nightmares of past memories in the Holocaust or during the Depression, and they're dealing with guilt and shame of maybe the way they raised their children or the way they conducted themselves. So there's a lot of meat there, and oftentimes chaplains are the only ones that they feel comfortable confiding in. We're not going to share anyone. We have share with anyone. We have complete confidentiality with them. And we also, our job is to sit with them and have the time with them. Doctors, nurses, PSWs, they're running in and out. And it's the patient with dementia on Apotex 6. It's the patient with mild cognitive disorder on Apotex 3. But when the chaplain comes in, it's Mrs. Schwartz and Mr. Rabinowitz, and we can sit and talk and cry and laugh with them and make them feel human and connect with them on a one-to-one, soul-to-soul basis. And that helps in bringing healing. It may not bring cure, but it brings healing. It brings peace of mind. It brings a feeling that I've been affirmed, I've been heard, that I am still relevant. My life still has meaning. It still has purpose. I'm not just waiting to die. I still have something to contribute.
Right. And I think what you're sharing with us is that Baycrest is really a very vibrant and rich community of so many different types of people. But sometimes we just think about the medical aspects, which are certainly important. But what you're telling us is that the spiritual support that you were providing is equally as important, I would dare to say.
Yeah, we look at this as each room is their home, and we treat it like their home. We don't just barge in, we knock on the door, we ask permission. It's their home, and Baycrest is their community. And so we gear things towards individuals, but we also have community activities, and we try to, it's what's the expression they use? It's not the quantity of days, it's the quality of life. And we're really all about providing that quality of life for our clients, whether it's daily worship services, whether it's cultural events, whether it's classes. And And usually there's something for everybody. We teach at, we have present things at different cognitive levels because our clients are of different cognitive levels. Not everyone can attend everything, but because, well, firstly, we overlap activities because there's so much going on, but secondly, because we try to fit what's appropriate to the client. Each client that we work with from a chaplain point of view has a spiritual care plan, much like there's a medical care plan that tries to meet those individual needs.
So maybe this would be, since you're talking so beautifully about, this community, maybe this would be the transition point that we could talk about how not only has the world changed, but obviously the Baycrest community has changed with the onset of COVID. How has that changed your role as chaplain and the other chaplains? How have you, most importantly, tried to keep all of the residents safe? How has that changed? What have you seen from what has happened from March until now? And can you share a little bit about that and your role, certainly, during this pandemic?
Sure, I'll share a couple of broad things, and then I'm going to put up a little bit of a PowerPoint, a presentation I made at University of Toronto about what we've done here at Baycrest during the COVID-19 pandemic. Firstly, I want to say we've been very blessed at Baycrest. At our height of the COVID pandemic, we only had 5 cases, 5 cases out of 1,100 beds. We are one of the safest, if not the safest, long-term care facilities in the province and in the country. Of those 5 cases that we have, 2 were sent to hospital and subsequently died, but the other 3 have recovered. And we've had an individual case here and another individual case there, and they've recovered. So really, we've had a total of 7 cases of COVID, and we've had 5 recoveries. And I think we're very blessed. And part of that is luck, but part of it is because we take infection prevention very, very seriously. The Baycrest is kept spotlessly clean and is constantly disinfecting the facility. So all the staff wear personal protective equipment. When I go to visit a client, I wear a mask, I wear a face shield, I have rubber gloves, I wear scrubs. So all of us take that very, very seriously. We also, because of the construction of Baycrest, we're able to socially distance clients. So it prevents the spread of disease. The other thing we do is that for chaplaincy, we follow best practices, meaning that I'm responsible for 2 floors. I can only visit 1 floor per day, so as not to spread any contagion from 1 floor to another. So, and so by doing these kinds of practices, we've been able to keep COVID at bay. We were also very blessed in that we anticipated some of this, and that enabled us to prepare. So we were able to stockpile personal protective equipment. We've been able to, through our worldwide partners, we've been able to get replacement equipment as it was used up. We smartly rationed things that we knew were going to be hard to get. And so in that way, we've been able to be on top of, if not one step ahead of what was going on in the COVID community. But it has affected what we do. I just mentioned that I don't visit more than 1 floor per day when I go visit, but I'm going to share with you some of the other things that we do. So let me go back to the beginning of this, and then I'll share it with you. Okay, so we were not able to have large gatherings or even small gatherings, so we moved our worship from the Wilinski Synagogue to our in-house TV station. We have a closed-circuit TV station, ultra-high frequency, channel 988. And so we moved our worship to our in-house TV station. All our worship services have been pre-recorded for Kabbalat Shabbat, Shabbat morning, Havdalah. And indeed, we did this also for all of our holy day services for Pesach and Shavuot, our Pesach Seder, our Pesach services. I'm currently in the midst of recording High Holy Day services for Rosh Hashanah and Yom Kippur. So that we've put all of these things are now pre-recorded, and they're accessible either on our closed circuit TV, or our therapeutic recreationists or the chaplains have been issued iPads, and they're accessible on the iPad. So we can go from room to room and share the service, the worship service with the individual client. One of the things we wanted to do was to bolster everybody's spirits. So we experimented with doing spiritual care moments. We would get on the PA system for just 2 minutes to start people's day off with a moment of encouragement. It was either a prayer, a song, or a poem. It was very, very well received. We're now going to a different medium to do this, but we do continue to provide spiritual care moments. So you can see we're using a lot of technology. Anytime there's a holiday coming up, Jewish or otherwise, we have diversity messages that we send through all staff emails. So we're in constant communication with staff who then convey a lot of this stuff to the clients as well about the upcoming holidays. It's an opportunity for staff to learn about Jewish holidays and for everyone to learn about other people's traditions as well. We do one-on-one personal visits. The chaplains go from room to room visiting clients. When we do, we protect ourselves using PPE to do that. But we still feel that that personal contact is really important, especially during the time when they were not allowed to have visitors, and residents felt abandoned, they felt lonely, they felt isolated, and particularly those with dementia oftentimes didn't understand, and even when we would explain it to them, they would forget right away. And so we were the human link for them. But we didn't only do one-on-one visits in person. We do what's called EVisits, where we would take our iPads with us. These are called cows. We didn't like that word, so we call them, it means computers on wheels. So I forget what we call them. We call them WOWs, workstations on wheels. But basically, we could wheel this into a room, and through Skype or WhatsApp, we could call into family members and facilitate a visit between family members and clients, patients, and residents at Baycrest. And that gave that connection. Some people were just fascinated with the technology. It was hard to have the visit because they were so curious about the technology. But after a while, they got the hang of it. But to see their faces light up when they see their loved ones on the other side of the screen is really wonderful. And sometimes we could step out of the room and allow them to have their conversation. But for those who are less capable, we would stay in the room and help facilitate the visit for them. We're putting together, just was approved, an EVisit, an e-prayer wall. So what this is it's a television screen where we can take from clients, residents, and patients at Baycrest, as well as staff members, as well as family, good well wishes and concerned messages and poems, and we can put them on these whiteboards that we have conveniently placed throughout Baycrest, so that people can see these messages of encouragement, that they're not alone. It's just another form of communication by which we can bolster people's spirits. And one of the things that has really come out of this is a deeper appreciation for what spiritual care is all about and what chaplains do in facilitating all of these. We've moved our classes onto Zoom. So the classes that we teach, that we chaplains teach, is done on Zoom. One of my rabbi colleagues puts together a Parshat HaShavua every week and sends it to either goes around from patient to patient and plays it for him, or they can pick it up on Zoom. Another one is doing a course on Midrash this way. I was doing a course on Tehillim, on Psalms, so we're able to do this. We also do holiday education by Zoom, and that's really geared more towards the staff. We provide staff support as never before. So it used to be that mostly on the palliative care wing, we had staff support. There's an opportunity for staff to come and unburden themselves. But we found in this time of COVID that the staff really needed to have that opportunity to where they could come together and, you know, find support for each other, vent their frustrations or fears. And what's interesting, one of the things that came out of it is that the staff wasn't so concerned about their own health and well-being. They figured, we know how to use PPE. We're very good about this. We're very conscientious. What they were worried about is the commute to and from the hospital if they had to take public transportation, or God forbid, bringing something home to their families. So these are some of the things that came out. Also, this idea of gratitude, that they liked to hear that they were appreciated, because many of these were doing double shifts. They were working much harder, filling in for gaps and really giving it their all. And sometimes they just needed to hear a thank you. And so one of the things we chaplains were able to do was to raise up this sense of appreciation and to affirm all the hard work that they're doing. And so the staff support group has now expanded to pretty much every floor in the hospital. And then my own chaplains, we continue to do our education in learning about spiritual care in times of crisis, disaster, and trauma. These are some of the resources that I got for our staff, so we continue to self-educate. We take seminars that come to us online, and this way that we can be up to date on what's going on, what our best practices in the field, and be able to provide, you know, the kind of support that our clients, patients, residents, family members, and staff need and deserve. So that's pretty much.
This is, I mean, it's all amazing what you're able to do in the midst of a crisis. Most of us, many of us, I think, imagine that facilities like this would shut down completely. But you, in a sense, from what you're sharing with us, have really reinvented yourself so that you are relevant and accessible to the residents.
Yeah, I like to think that not only is it the adaptability, you know, of the, so we learn in the military, you know, improvise, adapt, and survive, right? So that's what we did in spiritual care. But kudos also go to Baycrest, because they recognize the importance of spiritual care at this time. Other facilities in the Toronto area basically said that chaplains are non-essential workers and discontinued having chaplaincy. And they found out a little too late that what we do is really, really important. Baycrest recognized that from the beginning, and I think that that has been a real asset to the institution in recognizing that holistic care model as being very important. And we've been integrated in all facets of service provision at Baycrest, and really it makes a difference. The clients are well treated as always, but even in this time of high stress, they're being attended to and their needs are being met. But the biggest impact also, I think, has been for the staff. They feel so supported. They feel so appreciated. It makes it a good place to come to work. They enjoy coming to work, and they don't feel fearful about coming to work.
Mm-hmm. So what's happening now? I know that for months, people unfortunately weren't able to come in and, you know, sit and be with their loved ones. So what's happening now?
Right. So, you know, as Ontario and in Toronto in particular opens up, goes from phase 2 to phase 3, there's been more flexibility. Baycrest takes a measured approach to all this. Just because we can do it doesn't mean we should do it. So we have a think tank that comes together and kind of articulates what our policies are going to be. So for a while now, we've been having loved ones have been able to come and visit their family members who are at Baycrest. They would, because the weather's been so cooperative, they would meet in one of our garden courts. They would be socially distanced. They'd have to wear masks. And loved ones coming had to show evidence of a negative COVID test. Recently, we've been allowing family members to come into Baycrest. Again, it's once a week, half an hour, socially distanced, wearing a face mask, and having that negative COVID test. If you want to meet outside in the courtyard, you no longer need to have the negative COVID test. But in this way, we're allowing families to have as intimate access to their loved ones as is possible in this COVID environment. And then, of course, we continue to have scheduled EVisits. So just because you see them once a week, panim el panim, face to face, doesn't mean that's the only time you see them. You can, we have social workers and therapeutic recreationists and chaplains who can facilitate the WhatsApp and Skype visits in addition to or instead of those face-to-face visits. But it is this idea of measured openness to prevent a spike in COVID cases and to protect everybody who is at Baycrest, both our residents as well as our staff. Mm-hmm. And thank God, bli ayin hara and all that, we've been very successful in staving off COVID at Baycrest.
And I'm sure now that people can physically see one another, that must also be a big spiritual lift for the family members and also the residents.
Yeah, I mean, it's very emotional. Loved ones cry when they see each other. It causes the staff who witness this to cry. It's a very joyous moment. It's very emotional. It's like a reunion. And for some of them who are Holocaust survivors, it's almost like a family reunification event for them. And so it's a very powerful spiritual, emotional moment. And we try to support them and celebrate that with them and making it very, very meaningful.
Mm. I'm wondering if anybody has some questions. I mean, thank you, Rabbi Haber, for everything that you've shared with us. It's really given, I think, such a broad perspective on what Baycrest has done and is able to do, particularly now, even under these circumstances. So I'm wondering if somebody would like to ask Rabbi Haber a question. Feel free to do so, as long as you're okay with that.
The answer is no. What's the question?
So if anybody would like to raise your hand, or you can raise your hand electronically as well. You just have to unmute yourself, and then I can call on you. So I think I can see everybody. Anybody have, this is a perfect opportunity. You're not going to get this opportunity for some time to be able to dialogue in such a very special way with Rabbi Haber. So please take advantage of the opportunity.
Well, it says Randy Fine has raised her hand.
Okay.
Surprise. Hi. So I have a special interest in people with psychiatric issues. And I'm really curious how those people, not so much dementia, which is a whole other thing, but some of the people on the psychiatric care units, how they're managing with the changes in schedule and things like that around COVID.
Right. So our psychiatric care unit, we deal with individuals who have schizophrenia, who have bipolar disorder, but by far the largest number of patients treated with psychiatrically at Baycrest are those who are profoundly depressed or extremely anxious, or a combination thereof. And so they continue to get care. They're seen by psychiatrists who regulate the medicines that help stabilize them. But they're also involved with in group support meetings that are run by a psychologist. We even have a few that are run by a psychologist and a chaplain. And of course, we have chaplaincy visits that we make as well. We have 2 psychiatric floors, one in the apothex for people whose psychiatric condition is currently managed and under control. And then we have a wing at in the hospital that for those who need a little extra help, or it's a day clinic, so people can come in from the outside and in this way get the kind of support that they need. And a lot of times, from a chaplaincy point of view, just spending time with them is very reassuring, because there's this technique called pastoral presence, which is really about coming into the room very calm and helping put the person in a place of feeling secure and comfortable and not threatened. And chaplains are very good at this skill. A lot of that has to do with the fact that before we go into the room, we center ourselves, we make sure that we're calm so that we're not going to be transmitting any angst that we might have. There's a word I'm looking for, tell us something, but I can't think of it right now. But we can't, anyway, telescope, I think is what it is when we put our feelings onto others. And so a lot of times when nurses or PSWs are having trouble with somebody who's anxious or aggressive or acting out, they'll turn to us to come and do our magic and help calm the person down. And so, you know, it's been very managed, very well managed. Of course, we're a lot more attentive to disruptions because of the nature of the COVID and the pandemic and the isolating factor. And if someone is paranoid, this idea, you know, worried that they're going to get it or someone, and so forth. And so part of the response, other than what we typically do, is to pay more attention and be more attentive. There's 2 things that we're focused on, which I learned again from the military. One is called attention to detail, and the other one is situational awareness. So we try to be very attentive to what's going on in the general environment that might provoke or trigger someone, but we're also attentive to, you know, the details of what's going on with them in the immediate situation. And those things go a long way to nipping things in the bud if they try to get derailed.
Okay, thank you. Some other questions, please. As I take advantage of the opportunity, I see several people here who have had family members at Baycrest, many of you whom I know and have been there with you at Baycrest during the situations. So,
by the way,
yes.
I'm going to take this opportunity to plug you. Rabbi Seed is wonderful about coming to visit people to Baycrest. He really, really cares about the ADAF members who are in the care of Baycrest. And in a discussion with him, I mentioned that, you know, just as we arrange EVisits between family members, I'm happy to arrange EVisits for him to see clients, and he's taken us up on that. And so the floor chaplain on the floor where he has an ADAF member has already been in touch with him. They've scheduled, I think you already had the visit, right?
Yes, we had the visit.
So we're happy to facilitate that for our rabbis as well. Rabbi Seed is the one, I mean, or one of a few who've actually taken advantage of that and have reached out to use this electronic media to reach out to congregants who are at Baycrest.
Yeah, but we can't, you know, let people think that we've forgotten them, particularly now, when it's so easy to feel isolated and alone. Especially for the
work in partnership too. So I'm very happy to help the congregational. It's not like this is my territory, my turf, and you can't come on. I'm very, very happy when congregational rabbis support their clients. Either it's an additional support to what we do, or it gives us the freedom to attend to others who wouldn't have any kind of contact because we know that they're being seen by their rabbi. So it's really a partnership. I know that's probably hard to hear in the congregational world, that we're not competing. It's really a partnership with the rabbis, and Rabbi Seed is great at utilizing that partnership to make sure that the ADATH members at Baycrest are being supported spiritually by the congregation.
Thank you. But of course, you as well. I mean, works hand in hand.
Yeah. We have an ADATH member who likes, in pre-COVID days, he would hold court in the cafeteria every Thursday, and people would come and visit and spend time with him. He's a lovely, lovely gentleman. I can't say who he is, but now he can't hold court in person. So these EVisits are the best way.
Right, absolutely. Please, some questions. Raise your hand, unmute yourself. Fidel?
Thank you for your presentation. I really appreciate it.
My pleasure.
Rabbi. I'm wondering when Baycrest is planning to open up their day programs. Many people in the community really benefit from those programs, and I think it's hard on them as well. Do you have any idea when they may be opening?
Well, yes and no. I do know that it's coming, but I don't know the precise date. I know it's coming in two ways. One is, I think that they will be looking to open up the day programs once we enter into phase 3. But what we're trying to do now is, what we're working to do now is to bring Baycrest to their homes and do the day program virtually. In people's homes. So, I mean, I've been in touch with our tech people. Faith Malik, I don't know if you know who she is, but she had
also a member of ADATH Israel.
Okay, so she is working on how to bring the day program to the clients if we can't bring the clients to the day program, and we're in the process of doing that. I thought it was going to be launched July 13th, but we ran into some technical difficulty, so we're hoping it'll be launched early August.
Thank you.
Mm-hmm.
I know so many people, so many of our ADATH Israel members, but so many from the community really depend on the day program to get out of the home or their apartment to interact with others in a very positive way. And it's something that I know has really been so difficult for so many families.
Also give care members an opportunity to have some respite, that they can take care of their own personal needs, and while their loved one is being cared for in the day program. So we know it's a vital service, and we know we want to get it up and running, but we want to do it safely. Two things: we don't want anybody from outside bringing COVID in, but we also don't want to expose healthy individuals to potential contagion that might be at Baycrest. So we want to do it right. We want to do it carefully, but it is on the agenda and is being addressed.
Good.
I
think it's
again,
over.
Some other thoughts, questions. This is the
7:57.
Okay. We still have a few more minutes.
Very dependable airplane, by the way. The 757 is a very dependable airplane.
Yeah.
It also happens to be the time.
Yes. Yeah.
Oh, I'm wondering if you have any suggestions beyond making a phone call to a resident that would help both sides stay connected.
Yeah, well, there's a number of ways in which we can do that. Again, one of these things, aside from just a telephone call, is the EVisits, where you actually have a chance to see each other virtually. But again, we are now open and welcoming people to come and visit loved ones who are at Baycrest, provided the appropriate precautions are taken place. And that's another way. But you know what? Even cards and letters, something that comes to them in the mail, that's also, very, very appreciated by residents. It's something to hold on to. If you have grandchildren who can draw pictures and send it to them, those are all wonderful things. And we put them up on the wall, so they're keepsakes and reminders to family members. And it also lets the staff know that this individual is being attended to, that they haven't been forgotten. Because isolation is a big concern. And so when we see cards and letters coming in and it's going up on the wall, we know that family members are concerned and trying to engage. So, you know, so there's the telephone calls, there's the e-visits, there's the impersonal visits, either out in the garden or in the room, provided the appropriate precautions are taken. And then, you know, cards and letters are always welcome.
Thank you.
Mm-hmm.
Anybody else we have a few more minutes left. Again, as you can see, you know, Rabbi Haber is a wealth of information when it comes to our residents at Baycrest and the connection that we're making. Gail?
Okay. I, as you know, no longer have a family member who's a resident at Baycrest, but I know a number of people who are, and I still attend the Family Advisory Council. And on behalf of all the families there, I want to say thank you to you, thank you to the staff. The families are extremely appreciative of what everyone has done. Please pass it on. It's been a pleasure, actually, for me to be attend meetings the last few months and hear how happy and appreciative families are. Because over the years, frequently I have attended meetings with people very unhappy. The main thing they're unhappy about is that they can't see their family members. And even with the outside visits and now indoor visits, everybody wants more visits, which is natural. But the main thing is that they're extremely grateful to the staff. And also the fact that people are in individual rooms, which over the years I've heard comments, including from staff, about how more difficult this makes things. I think everybody fully appreciates in this case how much better it's made things, that it's been possible to keep COVID, even when it got in, keep the people very separate from each other, isolated from each other. And infection control at Baycrest has been far superior for many years to any other home. And it's really been proven in this case.
We take pride on being the benchmark by which others measure their success. So we really try to be on top of things. It's made things a little more difficult. Instead of gathering the residents together to do Kabbalat Shabbat, I now go to each individual rooms and I do Kabbalat Shabbat. So instead of 1.5 hour Kabbalat service that we do together, I end up doing, 10-minute Kabbalat Shabbat services, but it was what we can do. Honestly, I don't think things will get back to normal until we have a proven vaccine. And so I think we're looking at a good 6 to 8, 10 months before we're going to, on the optimistic side, before things stabilize in that way. But we'll be here and continue to provide services. Of the 4 chaplains that we have at Baycrest, 2 are full-time and 2 are part-time. During this COVID-19, they're all full-time. The part-time ones, there are other places where they were working, again, designate them as non-essential and told them not to come to work. Baycrest said, we'll take you, we need you. And so they're all full-time here, and they're all working overtime to, ensure that everybody's needs are met. Spiritual, emotional, physical, and mental.
Thank you.
Any other questions? If not, I think on behalf of all of us, I'd like to thank you for sharing this conversation with me and with all of us tonight. I know many of you here who've had family members at Baycrest know how important Baycrest has been over the years, but I think what we see now, especially since you've been there for the past 8 years, is really integrating in a deeper way the residents with their spiritual needs and also the families with their spiritual needs, and keeping our older adults vital. Baycrest is not a warehouse. It's not a place where you send somebody and say goodbye. That's not what you're doing. And you are proving that by, even during this time of COVID, reaching out and involving family members and residents in really substantial ways. So Yashkoch to you and your staff for what you've been doing, for all the residents of Baycrest and their families, and for the entire community. We really are so fortunate. There's not that many Baycrest facilities, places like that in the country or in North America. And we are so fortunate that we have Baycrest right here in our community, and with someone like Rabbi Haber, who's the Director of Spiritual Care.
Well, I want to thank you for inviting me to come and speak, and I want to thank all of you for listening and participating through your questions. And again, one of the things we like to say at Baycrest, it's not about adding years to life, it's about adding life to years. And so we thank you for your sacred trust. We take our task very seriously, and we feel, at least in the spiritual care department, that this is a real sacred calling, what we do. And when we walk into a client's room, it's holy ground, it's sacred ground. And we get as much, if not more, out of our visits with them than I think they get with us. So it's a pleasure to serve the Jewish community in this way and to enrich our lives in this way. And again, I thank you for the opportunity to share, and look forward to working together to ensure the health and well-being of our clients, residents, and patients at Baycrest. Thank you for your continued support.
Okay, thank you. Everybody have a good evening. Stay safe, stay cool, drink lots of water over the next few days. Right. And we look forward to seeing everyone soon. We will be together next week. Sister Lucy Thorson is here with us this evening. She's one of the people here, along with Mary Watson, in what I know will also be a fascinating conversation about interreligious dialogue, particularly in the age of COVID. So good evening, everybody, and stay well and stay safe. Bye.
Bye. Thank you again.
Thank you.